Talked about those toxins, good estrogen, bad estrogen, repair and recovery. So a few supplements that I'm going to talk about. And before I talk about these, well, there's one I didn't make a slide on. Probably one of the most important is vitamin D. So vitamin D is associated, or deficiency in vitamin D is associated with a higher risk for breast cancer. The first thing they did when I was diagnosed was test my vitamin D level. Optimal is 60 to 80, and mine was 28. I test people's levels. Insurance doesn't like us to do it now. Sometimes you have to pay cash. We were testing too many people, so they decided not to pay for it. But I did it for a number of years before they changed that law, and almost everybody in the state of Washington is below 30. It's really because we're at too high of a latitude to activate much vitamin D in the skin. If you go to Hawaii or on the equator, and you have to have some sun exposure, and we don't. Vitamin D is not a vitamin, it's a hormone. Remember I said estrogen, testosterone, progesterone, they work in the DNA of the cell telling it what to do, and so does vitamin D. So you can imagine if you have a vitamin D deficiency, your potential for colon cancer, lung cancer, breast cancer, prostate cancer, it just goes on. So vitamin D is very easy to find, and I usually recommend conservatively 3,000, but up to 5,000 IUs a day. Your vitamin D goes up very easily when you supplement, and as soon as you stop, it starts going down. So a lot of medical doctors recommend 50,000 IUs once a week. Well, you get a big spike, and then you're going down, and a big spike, and going down. So if you are usually taking vitamin D but forget for a month, it sort of falls out of your routine, you're low again. Start dosing up. I just had a young guy come in today with stage 4 colon cancer. I gave him a 10,000 to take for like a week and a half, and then go to 5, just to, get that vitamin D level up. Again, remember, vitamin D is regulating cell development. It's influential in how those cells protect you. Another really good one is the CoQ10. CoQ10 has a lot of literature out there about it, but it is in most of the breast cancer protection protocols. But it helps with almost all cancers. It works in the mitochondria, which is a little organelle in every cell, where we make energy in the cell. And it easily becomes deficient. It can be damaged. You can have a deficiency. Anybody on statin drugs for lowering cholesterol needs to have CoQ10 because it's destroyed by the cholesterol, by the statin drug. So, and guess what? Muscle is more susceptible than your heart muscle. Your heart muscle is a muscle that never gets to rest. It never takes a break. You don't stop your heart for 8 hours and go to sleep. Your heart always is pumping. So the heart is an organ where you will pick up nutritional deficiencies first, in an arrhythmia, in feeling fatigue, and like low endurance, low stamina. Because if you have a real nutritional deficiency, that muscle will show it. So CoQ10 is really important for the heart and for breast cancer cell protection. So I said, 200 to 400 milligrams a day. Some are more bioavailable than others. It's rather expensive. So you can start conservatively. If you are suspecting you have cancer, or you've had a cancer diagnosis, you might want to dose up a little higher. You can get CoQ10 in certain foods. And if you're eating a whole food diet, these foods might be, ones you have in your diet on a regular basis. Selenium is also protective. It acts again like an antioxidant. And antioxidants, that's such a buzzword, but antioxidant means when a toxin is sitting next to a breast cell, for example, the antioxidants in your body, the toxin actually wants to steal an electron off your breast cell, and if it does that often enough, the cell starts falling apart, at least gets inflamed, becomes vulnerable to damage in the DNA. If you have a lot of antioxidants around, they offer up an electron to that toxin to kind of neutralize it and spare your cells from damage. So the antioxidants from fruits and vegetables are amazing, and selenium is one of those that especially has some cell protection, not only for cells, but for your DNA. and also really valuable for the thyroid. That's another lecture, but to have active thyroid hormone T3, you have to take a protein off of T4, which is being carried around in the blood. You need selenium to take that protein off so you have an active available T3 to actually stimulate your metabolism and burn those calories, make you feel like you have energy. Curcumin is another one that's in a lot of the literature as a breast cancer protection, something for cell protection, but it's probably, again, one of those nutrients that is invaluable in protecting you from all kinds of inflammation, joint inflammation, skin inflammation, diabetes, cancer. Curcumin I just listened to this guy on the radio on the way to work, and he said he Googled curcumin, and he said there was a potential to get 240,000 articles on Google on curcumin. I mean, the research, and he started kind of the research, I think he said like 7 to 9 years ago, but now it's really in vogue. And it comes from the root herb turmeric, right? It's in a lot of spices. It's that kind of curry spice. But strong antioxidants and very protective for preventing the growth of a blood vessel system to cells that are abnormally dividing. So it kind of prevents that feeding them, because if you get a little tumor or mass, your body has to make a blood supply specific to that area to then let it really grow. So it protects that. It's preventative for Alzheimer's. I mean, just really amazing. So neurological conditions other than Alzheimer's, it's got a lot of literature about that. And I put a few little websites. If you're interested and want more resources for some of this, you can let me know. But I wanted to kind of highlight that one because it'll probably help you with joint pain, help protect your muscles, protect you from cancer. It's really invaluable. Green tea is a lot of literature and a lot of studies on green tea protecting you from breast cancer. Japanese women had a lot lower risk. That's one of the reasons they started looking at it. Again, another really strong antioxidant. So it protects cells from damage, including your breast tissue. And it's easy to do, add a few cups a day. I tend to be a little sensitive to green tea when I drink it, get kind of a reaction in my throat. So I have a couple formulas where they have the green tea in it, the DIM, the curcumin, kind of put a bunch of things together. But, if you can drink it and you enjoy green tea, yeah, go ahead. Yeah, the catechins there are even there when it's decaffeinated. Yep. So I talked about a few supplements if they're not in your regime and you're wanting to be proactive. This guy who came in today, he had never seen a naturopath. I did a thermography on him, stage 4 colon cancer, but I gave him like 3 things to do. And I think you have to wait. You can't do everything. Of course, I tried to do everything, but you can't do everything. And I think one of the things to think about with supplements is rotate them. Keep your D in all the time, but maybe you really focus on the CoQ10 for a while or the curcumin. And if you take breaks, I think a couple days off a week is actually sort of like taking a break from food you eat every day. Change the vendor where you buy products. Some products have a little better, maybe more concentrated form. Another product might have a better combination to go with it. Another company might have a better source for the product. It might be more bioavailable or more active. So I like to change the products up. And even when my patients come in, I try to talk them into it. But you get comfortable with certain ones and you think that's it. But, my reactions to foods, if I do them too long, could happen with supplements too. So I like to change it up so I'm not getting a sensitivity to anything. So we've talked about diet, estrogen dominance, stress. That's a big part of this talk. And how am I doing for time? Pretty good. So stress, for me, I'm kind of a type A personality, go, go, go. I did 20 years of psychotherapy. I thought I took care of a lot of that. But about 90% of the way we operate in the world is unconscious. something we learned a long time ago through life, how to perceive life, what to expect. It's almost, kind of in our DNA even. My mom was just like me. She was a worrier. My grandma was, pretty critical. I'm pretty critical. So, some of it we're hardwired for. But, to own up to that and to start having some ability to work with your unconscious and change that automatic reaction takes only attention and being intentional. I worked really hard the last 5 years or so to be different at work, to not just, power through it and be organized and multitask. I just decided, I'm going to cut down the number of people I see every day. I'm going to, try to maintain a lighter atmosphere. I'm going to have a little mantra I say every morning that I'm calm, I'm relaxed, I'm having fun. And I'd say, I've made progress. I still fall into it, but I'd say 60, 70% better sometimes. So to me, that's really good. And, I was really motivated. I knew that was what I had to do. It was pretty clear to me that was contributing to my aggravation and why my body was breaking down. So anytime you have the ability to get your emotions out, they probably won't get stuck and start creating what do I want to say? A habit in the unconscious that may or may not even be true. How many of you worry? How many of you would you say are worriers? Okay, good. And how many would say maybe you're pessimistic? Maybe the glass is half empty. And I guess how many of you have buttons your husband can push? Or your partner. So, I think the point is, we're all carrying sort of this emotional story inside, and we're reacting from that story. Mine was, I need to take care of everybody, and I have to be in charge. And so I perceive life that way. My husband helps me at the office, but he can never help me enough because I feel overwhelmed. Like that story in me just is so strong. Now, it came from a time where I was given responsibility way too young, taking care of all those little kids. And I would say that was trauma, right? As an adult, I can start unwinding that trauma if I have somebody to identify the emotion, have some, intention to change that story and be involved in a new story. So you can do that too. You don't have to do 20 years of psychotherapy, but you can start getting in touch with how you want to be different, right? And I had this really good doctor once do a presentation, and he said, you're going to be the best doctor in the world if you can get your patients to tell you how they want to feel when they're well, when you've healed them, or when you've helped them. But you know what people tell me? I just can't get rid of this headache. I want this headache to go away. I'm just so tired of this weight I've gained. I'm so, I'm really desperate. I have a cancer diagnosis. But, if you ask them, if you lose 20 pounds, what are you going to be doing? How is that going to make you feel? I'll be running up the stairs with my granddaughter on my hip, I'll take that trip. I'm afraid I can't make it if my back's hurting, If you can have a story in your mind of how you feel when you're different, not focus on the problem, but have an image of what you want and how you want to feel. When I got that cancer diagnosis, besides being totally devastated, scared, I made a vision board and a poster board, and I just sat down with myself and put images on there, and there were these people holding this woman up, and she was a survivor. And, I had words there, and I had that up for like 3 years, which took me to get through all the reconstruction and feel like I was on the other side. But I knew I had to have an anchor. My unconscious had to have an anchor, and I wanted to be intentional and not just hope I get well. I just hope I get well or hope I don't get breast cancer. It's not really the same as saying, I'm going to have healthy breasts. I'm going to do 2 new things tonight, and I'm going to keep my breasts healthy, right? You have to have intention, and part of it, I think, back to the story about coming to terms with your emotion, is if we don't have an outlet for our emotion. I didn't at 7 have an outlet for my emotion about how I felt taking care of all these brothers and sisters. I was just traumatized because my brothers were mean and they were not good. And I was traumatized, but I didn't say to Mom, I'm traumatized. I internalized a state, and that persisted up until my 50s. I mean, good grief. But we're all the same. That's how our subconscious operates. So, I have techniques. I go to people, I engage in affirmations and these intentional statements, and I'm still releasing, still finding a way to be free. And, we're all going to die of something, but I want to feel good while I get there, and I want to be happy, and I don't want to be mean to my husband, and I want to enjoy my day when I go to work. So I'm, keep doing a little more all the time. That's a little picture of a vision board. Might not be the one I used, but kind of the idea, pictures and images that depict how you want to feel, how you want to look. There's more wisdom in your body than in your deepest philosophy. I guess one of the reasons I like to talk is because it's my story, and I feel like we all have a story. It's good for that story to be shared because, when people tell me their story, there's a lot I can relate to. The emotions they went through, how little miracles happened, I think. And when I actually got diagnosed, I hadn't had a mammogram in about 7 years. I'd gone through my first husband's cancer experience. I was in medical school. I didn't really like mammograms. I was still pretty young, too, mid-40s, early 40s. But then one day I thought, I think I should get a mammogram. Oh, I don't know where that thought came from. I know we were going on a trip, and I went on the trip, and I came back, and I did it. And sure enough, I had an abnormal. So I always tell women, listen to that little voice, Just don't come and do a thermogram and say, okay, I don't need one now. If you're getting an inkling you do it. I mean, as a doctor, you'd much rather rule out the worst case scenario, But if you're comfortable, I'm not comfortable getting one down. There's no voice raging in my head saying I need another one. I'm doing other diagnostic tests. I'm, being proactive. But if I get that feeling again, as many cancers in breasts are diagnosed on palpation as they are on mammogram. So if you're palpating your breasts, you're in touch with your body, you're listening to that wisdom of your body, using your intellect, using your common sense, you can make a good decision, and your body will lead you. And, that's probably a picture of me feeling, like I've gotten to the other side. We did, a drum circle in my clinic not too long ago. Engaging with people that I love, that I care about, being involved in purpose, is really important for me. Kind of keeps my spirit and my connection to my spiritual center. So I did give you a handout. This is your handout for recommendations for breast health. And I don't know if I can even read this, but it goes over the diet, it goes over some of the reducing toxins, it goes over a couple of those supplements. I hope you all write in vitamin D if you aren't taking vitamin D, because that one should be on there. Uh-huh. I guess. Yeah. There's a lot of, there's controversy about everything. I think you have to, have an informed, be informed and look at the literature. There'll be pros and cons. I have to admit that the medical community has a bias against naturopathic medicine that some are overcoming or some are getting more educated. Naturopath gets 3 times as much biochemistry as a medical doctor. Our emphasis in school is looking at underlying cause and how the body rebuilds and repair. So our interest in nutrition, our history of understanding that biochemistry is much broader than the medical doctor. Where we're learning biochemistry, drug companies are lecturing to them about what medication to use for a condition. So it's not they're really great diagnosticians. You know, they have the MRI machine, they have the ultrasound machine, they know how to do surgery. They're really good in what they do, but there's a big piece of their education that they don't, that we get. And so, you know, some of the information out there downplaying the effects of vitamins and mineral are there. And, you know, you can do too much, even a little bit of a nutrient. If you do too much, it can be bad. So I think you have to look at the source and, you know, make an informed decision. Yes? Right. Well, the next part of this talk, I've got about 20 more minutes, if you can hang in there with me, is on the thermography. So I'll talk a little bit about that. Oops, sorry. There we go. I got it? Oops. Sorry. There we go. So you wanted to know a little bit more about mammogram versus thermography. So I have a piece of equipment or a service in my office where I do regulation thermography. It's a test where you can get information about what's going on in your breast tissue. So the thing about a mammogram, well, how many like getting their mammograms? How many have had sort of a traumatic experience with the mammogram? I have. You know, they can cause damage to the tissue, right? They're not comfortable. They put your breast in a machine and squeeze it every direction. The gal I had doing the mammogram was telling me about her mother dying from breast cancer, and I'm like, why are you telling me this? So, you know, we are using a diagnostic tool for assessment of breast health, and but again, it's radiation, so there's some risk every time we're exposed to radiation to damage DNA and promote cancer cells. So thermography is a type of device where we can do early screening. We can detect abnormals in physiology that may be contributing to abnormal cells. We're picking up risk factors in other areas of the body that could have an impact on your breast tissue, and it's reflecting other organs and glands in the system. It's actually a whole body assessment. We can develop a treatment approach based on the thermography that's specific to what's happening in your breast. I just, you know, the whole thing about getting a mammogram, well, you don't have breast cancer yet. Bye, see you next year, see you in 2 years. I'm like, it doesn't seem very preventative, does it? You're just waiting for the bomb to go off. So I really liked thermometry, this particular kind that I had, because it can give you and it can give me, the doctor, a little bit more idea about what is in particular going on with your breast. So there's my little dog, Stella. I'd say she's also one of my, you know, treatment approaches. I guess I share her with Gary, but... So it's used for early detection. It can help look at underlying cause. It can help me and the patient establish sort of an approach, what's going on there, and kind of be proactive. It's picking up abnormals maybe 5, even 10 years before something's even a disease process. It's gentle, it's painless. You just are taking temperature points on the skin, about 100 points from the waist up. They were taking a little wand. I'll give you a little demo of that. Takes about 30 minutes. I do about a half an hour interpretation of that.
So you're saying that instead of a mammogram?
No, not necessarily. I'll get to that, though. The thermography, again, is looking at the whole body. We're measuring a reaction in your tissue that is measuring how your body cools. So we have about 100 points where you take these temperature points and you're clothed, kind of with an open, loose blouse. And then you stand unclothed for 10 minutes, and then we take the temperature points again. So with normal physiology, your body should cool in an expected way. And if you have inflammation, infection, toxicity, cancer, the body doesn't cool in the way you would predict. Now they've done, hundreds and thousands of these, so they're pretty sophisticated now in implying maybe why your body's not cooling and what it's related to. Oh, sorry. The idea is, that guy's finger there, if you touch that or measure the temperature at the end of his finger, it's really not just the end of his finger. There's a neurological reflex arc that goes to the spine, the nervous center, but it travels through the muscle, through the circulatory system, through the lymphatic system, sometimes to an organ or gland, depending on where the points are. And all of that is reflected in how the body cools. So if you have this reflex arc and these specific points that they're measuring, you're actually picking up infections, possibly metabolic abnormalities, circulation, lymphatic congestion or impaired lymphatic flow, organ and gland associations. So you might pick up abnormals of the breast. You're going to pick up some things maybe in digestion. You could pick up abnormals in the teeth. It is a whole body exam. And then specific for the breast in particular, let's say I'm working on digestion and hormone balancing with somebody. I might be worried about estrogen dominance with that woman. I could do a test to find out, but I don't know if her breasts are toxic. I don't really know if she has heavy metals. I don't heavy metal test every woman who has, comes in. So how do I know what's really going on with their breasts? This test allows me to look at some of that. Is there maybe food sensitivity associated with the health of her breasts? Is there a lymphatic problem? Is there an area that looks suspicious? It gives us more ideas about what's happening in every woman's unique breast tissue. It's an adjunct to mammogram and ultrasound. It's not a replacement. So I just went to this conference this weekend, right? And this doctor who's the guru totally dissed thermography. Now there are a couple types of different thermography. One's where you just get sort of a picture of the skin. I think Dr. Wright's clinic does that, like an infrared picture of heat. So maybe the left breast has some heat, and they'll be suspicious of that, and maybe they'll decide you need a mammogram. There's probably some variants of abnormal. But it doesn't tell you why there's heat. Is that infection, inflammation, related to gut health, related to your teeth? Thermogram cannot differentiate what those areas are as far as whether it's cancer or not. There's a parameter of about 12 abnormals. If you have 5 or less, you have a really low risk for something serious going on. If you're in the 8 to 12 range of abnormals, then you're at higher risk for something going on. The tissue is not responding in the way you would expect. Probably want to get a mammogram, or a lot of women are trying to do ultrasounds in lieu of a mammogram. The only way to diagnose cancer is to do a biopsy. You can have an abnormal on a mammogram. The next test is an ultrasound with a biopsy. So a mammogram can kind of tell. Usually an ultrasound is a little more sensitive, but you have to get pieces of that tissue to decide. And even at that, if you get the diagnosis, you don't know why you got it, right? What was my particular risk factor? So no, it's not a replacement, and I'm not all or none. Some women are still getting them every year, every other year. That's fine. A lot of women come to me, they want to reduce a number of mammograms they're doing. Some women don't want a mammogram. They're not going to do it anyway. And, I just found out at CDI, the imaging center here in Federal Way, you can do a cash ultrasound on your breast for $85 a breast, which is actually pretty reasonable. So if you're really opposed to mammogram, you can just go pay cash and get an ultrasound screening. So there's ways to get around it. Unfortunately, if you use insurance, the insurance dictates you get a mammogram before you have an ultrasound. So women who really want to avoid exposure to radiation are having a hard time. So again, it's an adjunct to treatment. Again, it helps look at more underlying cause. And even from the thermogram, I've had a number of people like, we need to do an EKG. You've got some abnormals in the heart. It's not really showing up yet, but why don't we go ahead and at least get a baseline EKG? I've done ultrasounds of the liver, abdominal ultrasounds after a thermogram. I'll often do lab work. I'll do food allergy testing. Often the thermogram guides us to the areas of concern that might need further investigation. So wouldn't you rather, I can't read that part, know that there is possibly some changes going on in your breast or in your abdomen, maybe up to 8 years before you really have a disease process. Once, that's the thing about naturopaths. People come to us often as a last resort. Nothing else worked, and now it's advanced, and we can often still help you get well. But if you catch it early, work with your kids early in their diet, you're going to be way ahead of the game. So this is my daughter, lovely Christy, getting the thermogram, and that's our technician, Lauren, who does the temperature points. So it's a little wand. It's hooked up to a computer. It's not a big, scary machine. You're in a nice massage room. She does about 100 points from the waist up. I have a little video. Maybe we'll show it at the end if you're really interested, but it kind of shows the process. I have an instruction sheet, one of your handouts, on the preparation for a thermogram. Now we're measuring how your body's physiology tissue is going to respond in that 10 minutes of cooling. So a lot of the recommendations for the thermogram to get a good report is don't exercise that morning, don't take a hot bath or shower. You don't want to hype your body physiologically up into a state of heat. You don't want to wear anything binding. That pressure might cause added heat. You want to have breakfast, drink water. They have to be done before, I think, 1 in the afternoon. So they have to be done in the morning when your physiology is more regulated. Hopefully not when you've been ill or had recent dental work. You come a little bit early, try to be relaxed. And one lady got so nervous about it because, she'd had a husband that died of cancer, and she had worked herself up so much. We had to, okay, we're going to do it on a different day because this isn't going to be the best thermogram. So the instruction sheet is important to look at when you schedule and the day before you come, because you also can't have coffee about 24 hours. And I don't know how many people, oh, I forgot to look at that, but, they usually, we can fudge a little bit, but you want to follow most of them. This is what the report looks like. So the ideal color is the light blue. That would be normal tissue. Some areas of the body, the color means something different, but kind of in the trunk area, the really dark, like that trunk on the dark kind of purple black almost, is considered a blocked spot where the physiology is just not doing anything. Often that's a little more high risk, that something's been there for a long time. Again, that reflex arc, all the way the physiology from the circulation to lymphatics, the organ or gland that it's associated, that happens to be over the breast area. The hyporegulation, meaning it didn't cool very much, is red. Kind of a little more suspicious. Paradox, when the yellow areas, it got hot instead of cooled. Can be related more to inflammation, areas where there's inflammation. And the hyper, where it cooled too much, can often be related to toxicity or autoimmune conditions. When we get a report, it kind of goes through all the systems of the body, but then it has this priority of treatment. And in this particular person, we had the lymph system, enzyme dysfunction, food intolerances, dysbiosis. One side of the body had a little more attention as needing to pay maybe a little more serious than the other, and a breast side difference. So that would be one breast had more abnormals, maybe something to look at more closely than the other side. So you can see in this patient, a lot of it's related to gut health. That was kind of the priority. These aren't in order, but those 6 things are the areas that the thermogram picked up as highlighting the most. Now, if you're my patient and we're working on gut health, I'm like, see, I told you. So, you know, and if you're my patient and I'm not paying attention to some of that, it also says, hey, you know, we're doing enzymes, but maybe we need to do a candida protocol or investigate that. So it'll give me more information. I generally find about 60 to 70% of my treatment plan is addressing what shows up on the thermogram, and it is reinforcing for the patient to see that, you know, I'm not just pulling this stuff out of thin air. There's some correlation to signs, symptoms, lab work, but it's also picking up some things specific to your breast. So this is a breast thermogram, and you can see on that left breast, kind of under the breast there where the dark area and the arrow pointing at that, that has a little more of concern. Those top boxes there, you see the little X's? She has 5 checked. So even though she has an area of concern, she has 5 of the 12 kind of risk parameters, and that would be considered a fairly good thermogram, fairly low risk. Still does not say she doesn't need to go get a mammogram. You still could, and you still might after talking to her, especially if she had something she could palpate and had a big family risk or something. But on this thermogram, it looks like lower risk. Then we go to the boxes at the bottom, and it specifically tells her then what she could work on, what is challenging her breast tissue. So in this case, she has a tendency for some inflammation. All the kind of lighter blue across the top up there, even on the right breast, that's more of a toxicity, probably more in that area. But the thermogram says she has a tendency for inflammation, a mild tendency for cyst or fibrous tissue. What else here? Her lymphatic is mild, so an area that we could address. What else? I can't read these very well. A distant related focal. One side is the left side is looking a little bit. So on this person, along with the other report, let's say that first page we saw was hers, distant related focus would probably imply her digestion, because of the rest of the body, digestion's a big focus, is something that's impacting her tissue. A distant related focal can be digestion, it could be detoxification, it could be teeth. It's another area of the body that's having an impact. So part of the skill, I guess, in trying to interpret this and make some sense of it and generate some information for you to be proactive is putting sort of your whole body together. The lymphatics I'll talk a little bit about. Let's go back. The rest of the body is seen as a bar graph, and in this person you can see that top area has a lot to do with detoxification. Heavy metals are orange and red. He's got some global immune stress, which is a little more risk for cancer, some thyroid issue, or head, sternum. So it kind of goes through each system of the body, including the cardiovascular system, and it kind of gives you a parameter. Hey, you're really good here, but we need some attention there. I guess the skill is for me to put all that information together, including looking at your teeth.
And that's what I'm curious about. What would it tell you about your teeth?
Well, the idea with this, some of the information they imply from the way tissue cools or not is released on the Chinese medicine meridian system. And the teeth are each on a separate meridian system. So some of the doctors who work with advanced cancer and maybe other conditions that they're having a challenge, they're not responding to treatment, sometimes it's inflammation or infection or a metal on a tooth, on a meridian system related to your breast, your prostate, your detoxification system, that's impeding how that tissue can really heal. It's an energy kind of influence. So some doctors use that. I've had only several, that actually investigated something that came up here, but they were pretty serious actually when they investigated a little further. I usually will tell people, kind of break down what I'm seeing. Each different color on that chart is implying something else, but if there's an area of concern like this guy today who had the stage 4 colon cancer, he had 4 teeth that were associated with the large intestine. And he did have a lot of a lot of cavities. So I said to him, when you see the dentist, look at those 4 teeth in particular, make sure they've been x-rayed. I don't think he's going to make that a priority, but he can certainly include that in his, health and health screening when he sees the dentist. Some dentists are, kind of natural dentists are more involved in using this, but if you brought it to your dentist, they'd probably say, oh, whatever. But if it's related to your breast and you have breast cancer and it's related to the breast cancer you have, it's a tooth that needs a root canal or an old filling, you might want to have it taken care of. It probably is going to help. So what do we have here? So typical consult, I review the thermogram. I kind of, narrow it down to 3 to 5 things that they could do and kind of make it a priority. Integrate it into a treatment plan if you're already my patient. Might do other testing. I might say, I'm not saying you haven't had a mammogram for 5 years. I'm not saying this is replacing mammogram. If you also want to get a mammogram, you've waited 5 years, it's probably fine. But you have to decide that. If the woman comes in and she's adamant she doesn't want mammogram, I would probably direct her in whatever way, tell her what her options in if I think she needs further testing. Often good to follow up depending on your level of abnormals in 6 to 12 months. At least get a baseline, then have something to compare it to. Because that's the other thing, you can see if it improves. And often similar areas show up and then some disappear. Maybe something new will show up. But remember, if you're always going to have 6 things, so the things that you're clearing might be more risk associated versus now you're, cleaning up enzymes or something. So I'm trying to think of an example, but 6 things are always going to show up, but the ones that come after you've cleaned things up might be less serious. EKGs, I do here mineral analysis. If the endocrine system came up and your thyroid, I've done extra testing on thyroid. So again, there are some risks to mammograms. They're not without risk. And high rate of false positives. I mean, they treated my ductal carcinoma in situ like it was a cancer, but technically it wasn't a cancer because it wasn't outside it was still contained. But now they're treating most women like that's aggressive cancer because 40 to 60% of those will advance to aggressive cancer. So what do you do with that information? We're treating a lot earlier, but, I had to have my breast cut off and, go through hell. So I don't know, would I do it again? Probably. But, if we can be proactive, if you can incorporate a few of these things tonight and be consistent with them, adding curcumin or CoQ10 or eliminating wheat and dairy for a few months, that's helpful. But let's say you do it for 5 or 10 years. Man, you're way more protected. I mean, now your body's got those great antioxidants. You've had that protection for a long time. Still have challenges coming at you in your life, but the longer you do these things, the more protection you have. What else does it say there? I guess, it's just that radiation promotes cancer. So that is one of the biggest risks with the mammograms. Something new will show up. Again, this is an example of seeing one year and seeing one the next. Hey, that second one looks quite a bit better, doesn't it? It cleaned up a lot of the colon, probably worked on the liver a little bit. Still have some areas, that dark blue, of toxicity. A little bit of concern on those red areas. The lymphatic system probably still needs some work up there in the cervical area and in the neck. But that, I mean, if that was my patient or if that was me, I'd be really happy with the changes. Lymphatic massage, almost, I'd say 80% of women, there is some degree of stagnation in the lymphatic system and challenge to your breast health. So the cervical lymph nodes go down the neck. They're under your arms, right between your breasts and along the collarbone. So I kind of give my patients a little handout on lymphatic massage, but the basic gist is when you're in the shower, get in there and move that tissue. It's really superficial. The lymph system's very close to the surface, and if the toxins are sitting in there, supposedly being brought out of the body, but they're just sitting there, guess what? They start damaging the tissue they're around, or those lymph nodes get clogged. So I just say get in there with your washcloth or your hand and actually move that tissue around. You know, a little circular movement, move it down toward the chest, rub in between your breasts really good, get in there and squeeze under your arms, and just make that sort of a natural part of your hygiene. Get that lymphatic fluid moving. It's designed to bring toxins away from the tissue that are bad and protect those cells from damage. And where do we have a lot of fatty tissue that's storing toxins? In our breast. That's, you know, vulnerable tissue. So a lot of women don't touch their breasts. You know, I didn't really touch my breasts very much. I touch them all the time now. You know, I'm watching TV and I'm massaging them a little bit. And I just think we should get comfortable with our bodies and take care of it. Walking, water, some lymphatic teas. There's I think trampolines. There's a lot of ways to stimulate that lymphatic system. You can Google that. And, you know, most importantly, when you're taking care of your breasts, tell them you love them. Don't wait till you have to have one cut off and then be sorry you didn't love it more than you do. So tell your body you love it. Thank you for being so good to me. And I mean, I thank my body every day for the way it healed from all those surgeries. I mean, I am in awe of my body. I don't take it for granted, and I really do appreciate it. Way less critical than I used to be, and, you know, sort of glad I'm not perfect anymore. It's really nice. Love your body. Teach your mind to respect it. You know, a lot of those messages we had as adolescents are still going on in our mind, you know, and we've got lots of, you know, propaganda out there to tell us how we should look and how we should be and what size we should be. And so, you know, have a nice conversation with yourself when you're doing your breast massage, when you're doing your lymphatic massage, when you're taking your supplements. I mean, actually think about why you're taking them. I take time to write out for people why I'm giving them that and what I want, what change I want to see, because I want you to have that appreciation and look for that. Because if we're looking for that, then we're not being passive, saying, God, I hope I don't get cancer, downing our supplements. Say, you know, I'm doing the best I can do right now for my body. And I said to my body softly, I want to be your friend. It took a long breath and replied, I've been waiting my whole life for this. That's it. So if you have any questions, I'd like to answer those for you.